My name is Paul Tighe. I work as Secretary of the Pontifical Council for Social Communications in Rome. The Council is engaged with communications. The title itself is interesting, Social Communications. Some people wanted to call our council the Council for the Means of Communication, but other people resisted and said, no, communication is always more than just about technology and about means of communication. Communication is something we do even when we're not thinking about it. That's why I'm interested in how the church communicates. And often if we talk about the church communicating, we're thinking about press offices, newspapers, radio stations. But the church communicates above all by the way it lives its life, by its ordinary engagement with people. The vast majority of people out there who don't belong to the church see the church in and through the interactions they have, either with institutions that have Catholic in the name or people who represent those institutions. So one of the things we're always concerned is what are we saying even when we don't realise we're speaking? And one of the great areas I think where that is true is in the area of healthcare and in care of the elderly. That's where as Catholics, and not just as Catholics, but as people of goodwill generally who are engaged with caring for other people, that for me is an area where we say an awful lot, often at times without being aware of it. I'm very conscious sometimes when I go into institutions, healthcare institutions, which may or may not be Catholic, but certainly in Ireland at the moment, there's a great vogue for having great mission statements everywhere. But those mission statements are very worthy, very good for focusing staff on what they should be about. But they're a joke if the experience isn't actually in harmony with the great ideals that are expressed in such statements. And one of the key things is, how am I treated? What approach do people take towards me? Do I feel I'm cared for, or am I simply seen as somebody to be processed? And one of the core things I'd like to do is to reflect on how in healthcare in general, but specifically in Catholic healthcare, we should be trying to draw our fundamental approach from the example of Christ. In lots of ways, as a Catholic Church and Catholic institutions, and one of the things we have to recognise in Catholic institutions is we're never there simply to serve our own, and we're never on our own doing it. Healthcare is something fundamental. It's one of the most noble human aspirations, is to care for and look after another person. Therefore, obviously, as Catholics, we've no monopoly on healthcare. But what we do believe is that in the example of Jesus Christ, we're one of the great examples of somebody who engaged in healthcare, who engaged in care and looking after the people he met. And just a few points I would like to take from the example of the person of Christ. And you don't have to be a believer to see the value of this, because the great thing about Christ is Christ, we believe, was God, but he was fully human. So even if we don't believe in religion, or we have a different religion or a different approach, I think as human beings we can look to Jesus and see an extraordinary example of basic human care and love for other people. His whole message was about loving other people. He was very strong in the fact that God loves us first. We don't have to earn the love of God. We don't have to merit it. But we live in a world where most things come if you're wealthier, if you're fortunate, if you have power and influence, then you get looked after better. The message of Jesus was quite subversive. He said we have to be particularly attentive to those who have no claim, who have no power, who have no ability to insist on getting what they want. And I think the hallmark of good healthcare institutions, be they Catholic or not Catholic, is that the individual, the person who comes to such an institution, very often in need, is treated well. The medical attention they get is very important, but the personal human attention can be what they take home with them. That's the thing that can be most important. So if we take the person of Christ, just 4 points I would like to make is, many of us know the stories of the miracles of Jesus, the extraordinary, powerful miracles of Jesus, where Jesus met people in real need and cured for them and cared for them. First thing to say about that is he never did a miracle just to draw attention to himself. He never performed a miracle simply to demonstrate his power, or sometimes we think to prove that he was God. His miracles were simple. They were responding to basic human need. Do you remember a few years ago there was a guy called Uri Geller who fascinated us all by his ability to bend forks and to lift stones and this sort of stuff. But it was kind of meaningless. The miracles of Jesus are miracles of love responding to human need. So he always responded to the need of a person, sometimes by curing, sometimes by bringing them to peace, sometimes by simply helping them to understand their situation. And that's one thing that I think particularly in healthcare. You know, healthcare, we above all want to cure people, but we're not always going to be able to cure them. But even when we cannot cure somebody, we can continue to care for them. And one thing that worries me sometimes in medicine nowadays, particularly as medicine is becoming more and more technical, there's almost a sense of failure if we don't cure the person. And that is disappointing, not to be able to cure a person. And we would all want to cure. If I go to hospital, I want to be cured. I'm hoping I'll also be cared for. But there are times when there won't be a cure. But that means care becomes all the more important. And care means being attentive to the person, attending to their other needs, not just their physical needs, but helping them maybe to find a peace about who they are and about their story and about their life. And as I say, in Jesus, I see somebody who responds to the need of the person he meets. It's not about himself. It's about responding to the need of the other person. The other thing about Jesus is that his sense of the dignity of the person. Jesus cured and cared for people of every religion, of no religion, people who were powerful, people who were outcasts, people who were despised, and particularly in the time of Jesus where illness was often associated with judgment. So if somebody was ill, it was because they were getting just rewards for something they had done wrong. So there was a stigma about engaging with people who were ill, particularly if we think of the stories of those who had leprosy, where there was both a fear on the part of the community of being contaminated and then some sense that if they had leprosy, it was through their own fault. One of the things I think, and a real measure at times in my own engagement with healthcare, it's sometimes very easy to be sympathetic with somebody who's struck down by a cancer or struck down by a terrible illness, and it seems to be totally unmerited and wrong. We're not always as understanding and caring about somebody who's maybe their reckless lifestyle or their lack of attention to themselves has brought them an illness that seems almost, I would never say merited, but seems to be something they had brought on themselves. And we rightly at times want to help those people to break with a pattern of living, with a way of living, with a habit of smoking or a habit of drinking or drug use, that in order to make them healthy, we want them to break. But one of the things we have to be clear, our care, our love, our attention for that person cannot be contingent on them changing. We have to be faithful to them, accept that it can be weakness that has them in that difficult situation, and that in a sense, we find dignity in that person. I've been teaching medical ethics for years, and I was always going on about the dignity of the human person. I was inclined to use that as a descriptive thing, that saying every person has dignity. Some years ago I visited India, and we were waiting at a train station, having visited the Taj Mahal, and our train was 4 or 5 hours late, and we were obliged to wait 4 or 5 hours at a train station out in rural India. And that exposed me to a type of poverty I'd never, ever seen before. Young children who lived on the train tracks, who lived where the platform, kind of between the platform and the train, there was a little gap, and then there was almost like a little cave under the platform, and they lived in there. The trains came past, people discarded all sorts of rubbish, and the kids went out and gathered that up, and they were at the lower end of a chain or of a pyramid of recycling. But they lived, died, had their children in these conditions of absolute and complete poverty. And I remember saying, these people have, as a description, they have no dignity. Dignity will only come if I and others give them dignity. So when we talk about the dignity of a human person, it's not simply a description. It's actually a moral imperative. It's for us to give them dignity. Very often the person who's sick, who's had a bad life or a difficult life, has no sense of their own worth. They've been continually told that they're useless, they're a failure, they're a burden. They will only get dignity if we give it to them. So it's about reaching out to ensure that we give that dignity. And how do we give dignity to somebody? By giving them a name, by listening to their story, by being as attentive to the difficult alcoholic in corner one of the ward as we are to the person with the beautiful family in the other corner who were bringing flowers and expressing their appreciation to the hospital. And that's, I think, the real measure of it at times, is how good are we at looking after somebody who's not continually thanking us and telling us how great we are and expressing their appreciation for everything we do. It's up to us to give dignity to people who may not have dignity. And that's all about the little things. We can have great achievements and great ideas and great aspirations, but that's about how somebody who walks into one of our facilities, one of our homes for the elderly, one of our hospitals, when he or she walks in, does he or she feel welcomed? Does he or he feel that there's a care about them? Or are they being viewed from the beginning as a kind of an economic unit?